How to manage travel for cystic fibrosis imaging. Traveling with cystic fibrosis requires careful planning to keep your lung health monitored and to avoid complications. Imaging tests like chest X-rays or CORT scans are vital for tracking lung function, so knowing how to manage these during travel is important. First, always talk with your cystic fibrosis care team before planning any trip. They can review your current health status and lung function tests to see if you are fit to travel, especially by air. They might perform a fit-to-fly assessment, which simulates the lower oxygen levels at high altitude to ensure your lungs can handle the flight. It's also helpful to get a medical travel document from your doctor. This document should include your diagnosis, medications, recent lung function results, and any special instructions. It can be useful for medical providers at your destination and for travel insurance. Next, choose destinations with good access to cystic fibrosis-friendly medical facilities. Look for hospitals or clinics that can perform imaging and provide specialized care if needed. Find out where the nearest cystic fibrosis center or pulmonologist is at your destination and keep their contact information handy. Make sure your medications are available locally or bring enough supply for the entire trip. Planning your imaging appointments around your travel schedule is also wise. If possible, schedule scans before you leave or after you return to avoid urgent procedures while away. If imaging during travel is unavoidable, know in advance where the facilities are and confirm they follow infection control protocols suitable for cystic fibrosis patients. Environmental factors can influence lung health and imaging results. Check the climate of your destination, including air quality, humidity, altitude, and temperature. Avoid places with poor air quality, pollution, or environmental risks like volcanic smog or fungal spores that can worsen lung infections. Carry protective gear such as N95 masks to reduce exposure to airborne irritants. Always travel with your medications, nebulizers, airway clearance devices, and any prescriptions needed for imaging. Keep copies of your recent scans and reports to share with healthcare providers if necessary. Make sure your travel insurance covers cystic fibrosis-related care, including imaging and hospital visits abroad. Have a plan for emergency medical care, including how to reach cystic fibrosis specialists or hospitals with imaging capabilities. Practice good hygiene by using bottled or distilled water for nebulizers and sinus rinses to prevent infections. Follow strict hand hygiene and try to avoid crowded places to lower infection risks. By following these steps and working closely with your healthcare team, you can manage travel safely while maintaining your lung health through necessary imaging. Always remember that individual health needs vary, so personalized advice from your cystic fibrosis care team is essential for a smooth and safe journey.